Thank you, Governor. Good morning. I'll begin my report with an update on the weekly surveillance testing for school staff. This week, we tested 1,472 school staff statewide. To date, one case of COVID-19 has been identified by the testing. This translates into a positivity rate of 0.08%. The statewide positivity rate is 2.1%. We are in the process of reviewing next steps with the surveillance testing program, but no final decision has been made at this point. The school vaccination program has gone very well. To date, about 80% of all school staff have been vaccinated. I want to thank the health department, our other state partner agencies, and school districts for making this happen so quickly. Secretary Smith will provide more information on the vaccination program in his update. We made progress this week on drafting an update for what will be a major and perhaps final revision of our Safe and Healthy Schools guidance. This guidance was originally created last summer to help our schools reopen in September. The last time we updated the guidance was in October in anticipation of the holiday period. We are now revising the guidance a third time with a focus on helping our schools operate in the remaining months of the school year, when we expect conditions for the virus to improve as widespread vaccination starts to make an impact. We are also factoring in the cumulative negative effects of the pandemic on our students and seeking to strike the balance between the risks of COVID-19 as compared to the risks of their healthy development and academic success. A major feature of the guidance is that it's now a much smaller document. Previously, it was over 40 pages. The new version is about 20 pages. We're able to reduce its size by condensing some sections and by linking out to external resources. For example, the disinfection section is much smaller. When the guidance was first written in the summer, a lot of attention was put on articulating detailed disinfection procedures. This section has now been condensed and links out to external resources such as those provided by the CDC. In terms of Cdc recommendations, we are shifting our distancing standard to the new CDC standard of 3 feet. We are making this change after the health team has evaluated the recent CDC recommendation and the research behind it. That research basically concludes there is no significant difference between 3 feet and 6 feet as a mitigation strategy in schools. We also know that Europe and other New England states have been operating safely with a 3-foot standard for some time. Previously, we had adopted the 3-foot standard for students in grades K through 6, but 6 feet has been our standard for students in the upper grades. Now, all students K through 12 will be under the same distancing standard of 3 feet. The distancing standard does function as a minimum standard in guidance. Districts may operate under a more stringent distancing standard until they enact the new standard. This will provide some flexibility to schools as they plan to implement more in-person instruction. We have heard consistently from schools that the current 6-foot distancing requirement has been a barrier to their goal of implementing more in-person instruction. By making this change in our guidance, I expect we will see more schools move to full in-person instruction in the coming weeks. We are now in the process of getting feedback on the draft guidance from our education stakeholder groups. I expect we will publish the revised guidance next week. We did publish a smaller guidance document this week on the use of school facilities for the summer. School buildings will be open for fairly normal use this summer, but there will be some requirements around safety and mitigation strategies. This week, we also published our waiver for standardized testing. In Vermont, that testing is called Sbac. You can view our waiver proposal on the AOE website. As part of the waiver process, we are required to post the waiver proposal for public comment. We welcome comments on our proposal, and there's a link to an email address on our website to do so. Our waiver proposal follows the approved waiver template outlined by the U.S. Department of Education. The federal government is requiring us to hold the test. Our waiver proposal requests a waiver of the accountability provisions, which include a waiver from the 95% participation rate. This is the approach that most states are taking. A few states submitted more elaborate waiver requests before the U.S. Department of Education announced the actual waiver process. We are now seeing those other waiver requests being denied. Notably, South Carolina and Georgia had their waivers denied recently, and Oregon's was returned for further clarification. I am confident our waiver request will be approved since it conforms to the required waiver process. We will submit the waiver request at the end of April after the close of the required public comment period. That concludes my update. I'll now turn it over to Commissioner Pichak.